So what sort of lens should we go in for is what most of our patients always ask. And should we go in for a monofocal, for a trifocal, or an EDOF? So what exactly are this? So for a person to see clearly after cataract surgery, it requires an implantation of the lens, which is going to be an artificial intraocular lens. Now this lens is of various types. First being the monofocal lens. As the name suggests, the monofocal lens will help you see clearly for distance, and for near you require a reading power. Now suppose if I have a patient wherein the patient is like, no doctor, I don't want to use any glasses after cataract surgery. We have lenses for that also, that are known as the trifocal lenses or the EDOF, that is the extended depth of focus lenses. Now what do these lenses do is that they help us to see clearly for far, for intermediate as well as near. Intermediate vision plays important role, especially in those who are in front of the screens for long hours. So the trifocal lens gives excellent results. There may be just a 1% chance for very tiny reading material. Occasionally you may require glasses, but one of the qualities of a trifocal I would like to mention is that this lens has rings around it. Okay, so the way it is designed, there are particular rings within it that help us focus at various distances. So what happens is, because of these rings, any point source of light would spread after surgery. Now why is this important is for anybody who is doing night driving. Okay, so what happens is the headlight that comes in front of you, you will see it slightly spread. So this is a phenomena of every multifocal or a trifocal lens, be it Indian or imported. So this is not going to go, it is going to remain. It's just that the patient adapts to it over a couple of months. So this information is very, very important for anybody who is going in for a multifocal or a trifocal. That even I have operated patients where they do drive at night and they have implanted these lenses, and they do say that the light slightly spreads, but they sort of get used to it. But I do have certain patients who says, no madam, we don't want the light spreading because we do a lot of night driving, but also we don't need glasses. That's when you have the EDOF lenses. So these lenses, they help you see clearly for all the distances, and there is no spreading of light, but there's a 10% chance for requirement of glasses for reading near, for very fine prints in EDOF lenses. Not always, but there could be a chance. Another important thing that our patients must know is that cataract is just one disease within the eye. Undergoing a cataract surgery doesn't mean that you would not have any problems within your eyes in the future. If you're a diabetic or a hypertensive or you have high cholesterol, there are multiple diseases that could be responsible for your vision loss even after cataract surgery. So cataract, people are aware of it, which is a good thing, but that's not the only disease within the eye, and regular follow-ups are very, very, very important.